I'm KACEY Marra, Professor of Surgery at the McGowan Institute of Regenerative Medicine at the University of Pittsburgh and co-director of the Adipose Stem Cell Center. In our laboratory, we are researching new strategies to grow tissue, namely bone, nerve, muscle, and skin for our wounded soldiers. Approximately 70% of our soldiers who come back from the battlefield have wounds to their extremities, to their arms and legs, and involve nerves, bone, skin. Most of the injuries that soldiers see are actually from explosive devices such as IEDs or in training accidents, and because of the great protective armor and the preventative care, most of the injuries we see are to the limbs. So, for example, in this war, we have 50% less casualties than in previous wars because of the body armor and the quick emergent care. However, the soldiers that do come back to the States are suffering, and to regain their normal functional life, we need regenerative medicine. For example, a soldier I met a couple months ago had lost his ear in an IED explosion. So there are researchers at Wake Forest trying to regrow artificial ears made from patients' own tissue to help the soldiers. In our laboratory, we're interested in regrowing nerves. When there's an injury to the arm or to the leg, there could be a large gap in the nerve. And so what we're designing are tubes that a surgeon can use to bridge that nerve. This is a slowly degrading polymer tube. It looks like a straw, but actually it can be implanted in the body. The patient's own nerves will grow inside this tube until they meet up at the other end and reconnect the nerves. And then in a year or two, this material slowly and safely degrades. Our goal is to obtain a little liposuction fat from the soldier at training camp while they're still chubby, process out their stem cells and freeze them. Hope that they never need them, but if they do, if they are injured in battlefield or in a training exercise, we can thaw their stem cells, seed them into our scaffold, and regrow their new tissue. A bioreactor allows us to grow tissue in a 3D environment. So previously, we're limited in our laboratory in a 2D environment, but what the 3D bioreactors allow us to do, by the hoses providing nutrients such as vitamins and minerals to feed the tissue, and the lights providing heat to keep the tissue at body temperature, we're able to mimic the body conditions in a 3D environment using these bioreactors. One strategy that Dr. Gerlach is researching is to use a skin sprayer for burn patients. This therapy involves isolating a little piece of skin from the patient from a healthy, uninjured area, obtaining cells, and then spraying those cells with a spray gun onto the burn injury. Then hollow fibers are placed on the injury, which can feed the cells the essential nutrients and vitamins and minerals and sugars that the cells need to survive. And then the cells work to heal that wound and heal that burn. And then the bioreactor is removed, and new skin tissue is formed. In the 4-well bioreactor, which is a state-of-the-art, cutting-edge bioreactor, we are able to inject adult stem cells derived from fat into the bioreactor, billions of cells, allow that tissue to grow 3D and form human fat tissue, which we are unable to grow in normal laboratory conditions. So this 3D human fat will allow us to test drugs and to look at fat function, to compare diabetic patients versus non-diabetic, obese patients versus lean patients. And this is just one small part of what the bioreactors can do. They're being used for skin, for liver, for nerve, for bone. You can virtually grow any 3D tissue in these bioreactors and mimic the body tissue that you can't do traditionally. The bioreactor has 4 different wells, so we can conduct 4 different experiments at one time versus the first round of bioreactors, which was just one compartment. So these 4 different compartments allow us to reproduce our results very quickly or test different parameters also very rapidly and quickly without the use of animals. As a scientist, it's very motivating to meet these patients in person, to see the injuries up close and personal, and realize that what you're doing in a laboratory, at a bench, with chemicals, in a hood, has a direct impact. And if you can help at least just one person in your lifetime of research, it's worth it. I love science. I love experimenting. So I've known since 4th grade that I wanted to be a scientist, and continued to follow that path throughout high school, college, graduate school, and since that time, I've been working on materials that can help people.